All right, so welcome to the South Asian Public Health Association Spotlight Series, where we illuminate the remarkable individuals shaping public health, especially within the South Asian community. We're your hosts, Samira, President of the South Asian Public Health Association, also known as SAPHA.
And Thoyne, co-chair of the Communications Committee. SAPHA is committed to advancing the health and well-being of South Asians in the U.S. and beyond, fostering collaboration, advocacy, and research to address health disparities and promote equitable outcomes. Our podcast series dives into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
So today in our fifth episode, celebrating SAPHA's 25th anniversary, we're honored to welcome Kalpana Bhandarkar, an accomplished leader in healthcare and civic engagement. With nearly 20 years of experience dedicated to improving access to quality healthcare for underserved populations, Kalpana's expertise in healthcare leadership and advocacy is invaluable. She's also a founding board member of SAPHA, contributing significantly to its incorporation, development, and also co-authoring a chapter for the Brown Paper. Kalpana, welcome to the SAPHA Spotlight Series. We're thrilled to have you join us today.
Thank you. Thank you so much for having me. I'm thrilled to be here.
Awesome. So we'd like to start by diving into your journey in public health. Would you be able to share a brief overview of your career trajectory from your roles in New York City hospitals to your current endeavors in nonprofit leadership and advisory services?
Sure. So I started my career in Washington, D.C. at the Children's Defense Fund. I moved to Washington, D.C. and said, I'm just going to start my career there. I had no idea where I would land, but I was so lucky to land at CDF, you know how it's affectionately called, and have an incredible 2 years there. I landed in the health policy division. So I learned a lot about Medicaid, how Medicaid gets expanded for children, how it's accessible for children. And at that point, the Children's Health Insurance Program, which was for families who had a little bit higher income in states above Medicaid, had just been passed. And so we were working with states to implement their CHIP program. So it was kind of the foundation of my career, learning about Medicaid and CHIP, learning about the relationship between health insurance and healthcare access, because unfortunately, our country is not at the point where it's a universal belief that everyone should have access to healthcare. It really is tied to health insurance. And so that was really where I started my learning around this. But I also learned about how advocacy works at the federal level. I was on the Hill and going to hearings. I was working under a civil rights icon, Marian Wright Edelman, who really was just an enduring and adored civil rights icon, and learned so much about how she used her voice and her brilliance to start this movement around children's health and well-being. And it was really, I loved every day there, every moment there. And that started my career. And after that, I moved back to New York City, and I really wanted to understand healthcare delivery. And so I got a job at the Mount Sinai Adolescent Health Center, which is a community health center exclusively for youth. Age at that time is 10 to 21. I think it might still be the same. And so they provide medical and mental health services and health education to young people, regardless of ability to pay, confidentially if they want it confidentially, or they could bring their parents. And that was another amazing experience, sort of seeing these clinicians so dedicated to young people and providing them the care that they needed in a safe space over time. And then I got hooked in connected to hospitals. I did go from there to graduate school. So I got a public health master's and a MBA, and then came back to New York and really spent many more years in hospitals. So I worked at kind of a mission-driven healthcare consulting group where all my clients were mostly at safety net hospitals in New York State. Worked on a lot of healthcare restructuring. So it really was the beginning of hospitals shifting from inpatient care delivery for many of their services to outpatient, because we know that that's a really effective way of keeping people healthy. So we secured funding for them. We helped do strategic plans on which services they should expand. And I also worked with a coalition of providers that serve severely physically disabled children. So we did a lot of statewide advocacy to expand Medicaid waivers so they could receive long-term care at home instead of being in a nursing home, because we knew that they thrived at home. So that was a wonderful experience. Then I went to Maimonides Medical Center in Brooklyn. I revamped the research department there, and I served as chief of staff to 2 consecutive CEOs. So that was really being a Jane of all trades. It was working on development, working with the board, management, operations, communications, community engagement. I loved that role as well. And then shifted from there to New York City Health and Hospitals, so the nation's largest public health system in the country. And I founded and led the Social Determinants Office. So there it was really working with our hospitals and our federally qualified health centers and other outpatient sites to address the unmet social needs of our patients. So we had lawyers on site and expanded that program so that patients could come to get free legal care. We had SNAP, our food stamp enrollers co-located on site. We secured housing for many of our homeless patients. And we had tax return enrollers. And so really what we did was implement what a lot of people had been talking about for many, many years. And then the research and the evidence base had caught up, saying that it takes a lot more, in addition to clinical care, it takes a lot to keep people healthy. And so what we did was bring a lot of those kind of social services on site to places where patients felt comfortable coming to access them. So that was my kind of hospital journey. And then in parallel to that, for many years, pretty much since college, I've been on the boards of many nonprofits because I really wanted to stay connected after CDF to the nonprofit world. So been on a number of different boards. Right now, I'm on 3 nonprofit boards, one that focuses on civil rights, one that focuses on statewide child advocacy, and a third that focuses on leadership development for teen girls around the world. And then I shifted kind of on the professional side to do solo consulting, where my clients are healthcare entities and nonprofits, and I provide a variety of capacity building services. So strategic planning, philanthropic planning and fundraising, storytelling, communications, and coaching. So I have my coaching certification. So I do that and embed that into my with my consulting clients, but then also have individual coaching clients. So that's sort of been my journey over the last, I guess, 25 years.
Kalpana, that's amazing. You've definitely had a variety of experiences with healthcare improvements and health disparities work. I'd be really interested in knowing how SAPHA fits into this journey. So what inspired you to be a part of the founding board for SAPHA and became involved in advocating for South Asian public health?
Well, I really was the people, and probably I'd say the promise. And so I'll start with the people. I mean, just the most brilliant, the most passionate, the most committed people in public health. When you feel, I know that I'm not alone in saying this, when you feel that energy and that passion kind of emitting from people, it's really hard, and you kind of share that, it's really hard to kind of walk away from that. And so it was really the people that drew me in. I mean, Abhijit, Ushma, Sharmila, Amita, so many people who wanted to build what you all are leading, SAPHA. And so I was just drawn in from the beginning because I knew that it was something important. And it was something, obviously, that I felt in my heart is if I can use my skills and my training to contribute back to our larger community in this country, then I would like to do it. And then the promise was, really just thinking about, well, what can we do here? We had PhDs, MDs, MPHs, people who had worked, all over the world and coming together to really around a shared vision of improving the health of the South Asian community here. And so what could we do? And so I think that was really what hooked me in at the beginning.
That's really inspiring to hear. I think we've had a couple of these interviews so far, and it's just so great to like learn what the process was behind SAPHA and what brought everyone together. And I'm sure being a founding board member of SAPHA and deeply involved in its activities, right, as well as being a contributor to the brown paper, it's no small feat. It's a really big task that you take on. So how has your experience with SAPHA, as well as your broader involvement in the nonprofit sector, really influenced your career trajectory and personal growth in this field?
Yeah, in a few ways, I would say it was my first entrepreneurial experience. I think that sometimes people think entrepreneurialism is the exclusive domain of business, but it's not. I mean, people who start nonprofits, people who start groups like this, they are entrepreneurs as well. They're taking an idea and they're providing a foundation, building it, and getting people involved. And so it was absolutely my first entrepreneurial experience. And I learned so much about what, hard work and passion and commitment can do, especially, we didn't all know each other. We just knew we had some shared vision. And so we really worked together to build this. And so the logistics of founding the board, incorporating all of that had come together. I would say I really started to learn through SAPHA the importance of disaggregated data. So when we were putting the brown paper together, it was, I was working on the youth health chapter, and it was really, really hard to find, let alone Asian American data on the Asian Americans, which is such a broad group. And then to try to find a distilled version of that about South Asians was also difficult. And then the definition of South Asians varies, right? So you have to be clear about what's in this data. When you're lucky enough to find data on the South Asian community, you have to figure out what's in it and what's not in it. And so I think the importance of data and getting that disaggregated data, that became very clear to me at the beginning as we were really working on formulating SAPHA and starting to put things out there. And then the importance of data-driven decisions. So now we have this data. What do we do with it? How do we share it? Who do we share it with? And we had a lot of those conversations. And then I would also say when the brown paper was coming out and when SAPHA was releasing its statements and sharing, the information that it wanted to put out there, really being strategic about where we shared it, where do we need this visibility? It shouldn't just stay within the South Asian community. It shouldn't just stay within the Asian American community. We need this. The whole point was for there to be a broader conversation that when we deliver healthcare, when we have public health interventions, we have to be clear about how we are engaging different communities. And so that was something, that we learned a lot about, and I learned a lot about during our initial time.
So SAPHA definitely has been a learning experience for a lot of people. I've learned a lot about researching with South Asian, but also Asian subgroups. And speaking about that, I want to move on to mentorship because mentors play a crucial role in shaping our careers. So can you tell us a little bit about the mentors who have influenced your career and the lessons you've learned from them? And what advice might you have for emerging public health professionals on seeking mentors?
Yeah, I think it's such an important part of each of our journeys. I think about it in two ways. I think there are explicit mentors and there's implicit mentoring. So I was lucky to have a number of explicit mentors, and I think it happens organically. Or it happened organically for me. I'm sure there are instances where people kind of found, sought someone out and said, I really want you to be my mentor. And that's amazing. And when that happens, that's incredible. But it really involves someone proactively making a decision to carve out time to engage one-on-one with someone. And so when you're lucky enough to have one in your life or a few, it's incredible. I still keep in touch with, all my mentors. It's really important to me because they helped shape my decisions, my career, my experience at that job, and just my thinking around my professional trajectory. So That's, I think, a little bit of luck. There was a little bit of luck for me. It was people that felt or took an interest in my professional journey and also really listened, because I don't think mentorship is just about giving advice. I think it's also about listening and kind of just being there and giving a different perspective. And the reason I say the second one is implicit mentoring is I believe there's a lot of learning and observation. And so I've benefited a lot from just joining meetings that maybe I wasn't working on the project or wasn't involved, but I felt like I was interested in the topic and I could learn. Thinking about what I wanted to learn and trying to be a part of that, even if it was just from an observation perspective. And so I definitely encourage people. Certainly, if you find a mentor you can have a one-on-one or two-on-one relationship with, that's amazing. In addition, don't underestimate the value of implicit mentoring, because I learned a lot about leadership from observing other leaders. And then when I was in leadership positions, those learnings really helped me both in what to do and what to avoid. And so I think my piece of advice would also be there's a broad spectrum of how you can learn and be mentored. And sometimes it can be even in a passive kind of role.
Yeah, I think mentors really are so crucial to advancing our careers and just learning life lessons from. And I think also just the ups and downs of our careers are also great learning moments. And so just looking back, what do you think is the most significant lesson that you've learned in your career? And if you could go back 25 years to, like when you guys were founding SAPHA, or even just when you were starting your journey, what advice would you give yourself as you were building up your career?
Yeah, I mean, I think one of the most important learnings from SAPHA was at that point, in the absence of data, now you could say we have more data now, but it's still, we're always going to be searching more data, is really going straight to the community.
Mhm.
I think as toward the latter part of my boardship, we started to have more local engagement. And it's hard, it's a national association, so you can't be brought in national and local with an all volunteer group
Right.
who all have day jobs, right? But I think one thing I learned so much, and that's really a key part and has been a key part of my job, is wherever your seat is. And I've been lucky enough to have seats in, executive offices of hospitals and leadership positions. You cannot stay in your seat. You must go and communicate with patients, their families, staff at all levels, housekeeping, laundry, security. You've got to go out into the community. We were going, when I was at Maimonides, we went to community board meetings. We would talk to local community groups who were accessing care from our hospital or who weren't accessing care from our hospital. So we need to understand why some do come and why some don't. And so I think a huge part of public health is absolutely looking at the data, the broad data, making data-driven decisions, but we cannot ignore the value of going directly to the people whose lives we're trying to impact, to hear directly from them. And so in any job I'm in any client engagement I'm in, I always recommend speaking directly with all of the stakeholders. It's so important.
Amazing. So I'm gonna hit back on the SAPHA time. So going back to your time at SAPHA, we are curious to know, what was your most enjoyable moment?
Oh, I mean, I guess I would say that when the brown paper was released, there was so much effort that went into it. It was such a brilliant idea. So many people working on it, coordinating it. I was going back and reading it because I guess I also helped put the executive summary together and just trying to go back into that mindset of what we were working on. And again, like all of you, you have day jobs and you're doing this on the side because of your passion. I think that was a really huge milestone. Of course, founding the board and engaging with the brilliant people, as I mentioned. was another key highlight.
I think a lot of times just like the work that we're doing together is it's just so inspiring that it becomes enjoyable, right? And over the past 25 years, SAPHA has really achieved significant milestones, which many of you were either directly involved in or helped set the foundation for, whether it be the brown paper, other publications, partnerships that we've developed, a lot of the advocacy work that we were doing. Now that we have like a notable presence in Washington, D.C. with engagements with the White House and the Secretary of Health, and we're really just taking it to the next level. And a lot of it is because of all the work that you and your colleagues had put in 25 years ago. So given all of this, where do you think SAPHA can be the most impactful in the next 25 years?
Yeah. Well, first, it's amazing where SAPHA has come in 25 years. I don't know if any of us envisioned this, robust of an organization and how it's endured for 25 years. So kudos to everyone that has been involved along the way and everyone who's involved today in keeping this going. I think a lot of things. One, a lot of people think about public health as a vertical.
Mm-hmm.
And I would argue, I know a lot of people argue it's a vertical, but it's also a horizontal. And so we absolutely need the expertise in public health. We need epidemiologists. We need people trained in a lot of different areas in public health. We need local health departments. We need research in this area. And that is absolutely clear. But health, as we all know, does not operate in a silo. There's so much that affects people's health. And so when I say horizontal, I mean that we really need to make sure that public health is being discussed in a lot of different domains. And so when we're talking about safe and affordable housing, we have to talk about public health. When we're talking about environmental justice and safe environments, we have to talk about public health. There's so many areas where public health cuts across. And it's the same thing when we talk about public health, we have to talk about housing, we have to talk about the environment. And so they are interrelated. And so I think that's a big message that SAPHA can really start to articulate or continue to articulate. I mean, another thing is gender-based violence and violence in general, right? That has a huge impact on health. And so we have to make sure that the intersection between gender-based violence and public health is really articulated. And so I think that's a big role that SAPHA can play. I think to the extent you probably are already doing this is making sure that I think that the big charge for SAPHA is having a lot of impact within the South Asian community, but then also linking to the broader public health community, right? Because your advocacy and your impact is equally important in both domains. And so making sure you're at the table at, the American Public Health Association, decision-making, wherever that's possible, signing on to statements, having them sign on to your statements and things like that. I think it's really important that SAPHA's name is out there on a broad level, given all the incredible work that is being done. I would say also helping to depoliticize public health. It's really, really hard to understand how to do that, I would say, but I think it's really, really important that we ensure the public trusts public health professionals and public health agencies and can get accurate information, can get it on a timely basis about how to keep themselves healthy and how to keep their community healthy. I mean, there's so much else. I think that the other thing I struggle with a lot is we kind of live in a country that's a lot about individualization, right? Individual choices. You can be whoever you want to be, do whatever you want to, and that sometimes is at odds with public health because sometimes people have to make sacrifices or adjustments or do things that may be inconvenient for the betterment of the community's health. And that tension is really present. I mean, it's been present in COVID, but it was present way before that too. And I think SAPHA can, with many others, play an important role and use your voice to kind of articulate that for people. And just, I think the thing is really get people to think about that frame and think about how maybe sometimes the sacrifices that we can make, even if they feel a little uncomfortable, can be very impactful for other people's health. And so those are some things that come to mind. And the last thing is really talking to our own families, our own communities about how to stay healthy, about ensuring they have accurate and timely data and information to make their own healthcare decisions, and that they have providers that they trust to get their healthcare from. So I think that's maybe more on the personal level, but I think SAPHA puts out so many great resources that I think that's also something that could help.
Yeah,
Absolutely. Thank you. Thank you very much. You hit on a very important topic, that public health is very, very broad, and it captures a lot of different things under its umbrella. So your career has really expanded across many sectors, which has given you exposure to many different communities and their unique experiences. In your opinion, what are the most pressing public health issues faced by South Asian communities today, and how can organizations like SAPHA address them effectively?
Yeah, I think one is, which affects every single community, which is preventive care, making sure that people are going to see a provider regularly, checking their vitals, their bloods, getting the tests that they need to get. There's a lot of fear of healthcare clinicians. There's mistrust, but can we figure out how we can try to soften that a little bit so people know that they should proactively go, not to just go to the hospital or the doctor when you're sick, but also on an ongoing basis. So I would say preventive care. I would say, again, another really important issue that isn't talked about a lot is gender-based violence. I think we've all grown up and known it's prevalent in our community. It's not talked about a lot, and I think we really need to start speaking more about it. And it's hard because it causes discomfort. A lot of people are affected by it, and so people may not be comfortable talking about it, but we need to figure out ways to not only respond to and care for people who are affected by it and their family members, but also prevent it. So I think that's another really important issue. And I would say destigmatizing mental health issues and accessing mental health care. Again, something that affects not just our community, but a lot of communities. But we know that particularly with youth, but not just with youth, there is a lot of suffering going on right now. And there are resources often for people to help, whether it's hotlines or virtual visits with providers or in person. So we have to continue to talk about mental health as a component of overall health and really destigmatize that so people in our community are less ashamed or fearful of accessing that care. And I think those are three really important points.
Yeah, I think those are really in line with like a lot of the work that SAPHA is interested in expanding into. So it's always great to hear, like what people consider the priorities for South Asian health, because there's a lot of overlap, I believe, between what people see as a need. And it's great that, there is that overlap because it makes it easier for us to come swoop in and be like, okay, we're going to address them. And you guys have also done that a lot with like the brown paper and the health fact sheets that came out afterwards. Just really addressing some of the needs that was there at the time. And so we hope to continue to do that as well. And, leadership development, I think, is also a key aspect of your work, Kalpana, which, is evident through what you've done with SAPHA as well, but also currently with your, consulting business. So how do you believe fostering leadership within South Asian communities can contribute to better health outcomes, particularly for marginalized groups?
Well, I think, there are so many South Asian leaders in public health out there. There are ones that are established, ones, whose names we know, and there, I think, are a lot of unsung heroes. And so for me, I think raising the visibility of those leaders, and, it would be a dream to convene those leaders. Maybe SAPHA could do that. But really raising the visibility and having kind of developing some shared vision. I mean, people might be working on a lot of different things, but seeing where the Venn diagram overlaps for a shared vision among those leaders, and then ensuring that there is representation and inclusivity. I think even within the South Asian community, sometimes, there's Indians dominate. Talk about India and Indian Americans, and Indian culture dominates, but South Asians are a much broader group in terms of the country of origin, the religion, the cultural practices. And so I think we also have to, as leaders, be sure that we're open about that we're bringing all the leaders from all different communities to the table. And again, finding where the Venn diagram, the circles kind of overlap, so that we're sure that we can have as big of an impact as we possibly can. So I think it's really, really raising the visibility of the leaders, bringing them together to create kind of a shared vision where there's some overlap, and making sure that all the voices that should be at the table are at the table. And then I would say one other thing is, again, we want to make sure this work is not in a vacuum. And so making sure that we go back to our domains and educate and inform everyone, from our families to our communities, to our friends, to our kids, to our relatives, So I think that we each have the power in our own domains to be leaders, and making sure that we can activate that, I think, and making sure that other people that may not have recognized that in themselves are activated too. So I think that's another role for South Asian leaders in the public health space.
Mm-hmm. And I love your comment about going back to our own domains, because I think we forget that we have our personal bubbles too, our families and our local communities to get back to, and they're the ones who might need it most. So you have extensive experience in healthcare consulting with safety net hospitals, as well as serving on nonprofit boards focused on civil rights, child advocacy, and leadership development. How do you envision the intersection of these areas with public health initiatives, particularly in addressing health equity and social determinants of health?
Yeah, there's so much to say. I think part of it goes back to the horizontal. So making sure that discussions about public health, the importance of it, the impact of it, is in all the domains, that it is, when we're talking about environmental justice and housing, and all different legal needs and income, that the thread there is really public health, and that we're clear in sharing the research that unmet social needs affect health. When people don't feel safe in their home for whatever reason, or they don't have a stable home, the research is clear that it affects people's health. And so we need to name that, and we need to be clear that, again, it really affects all these domains. So I think that's a big part of it. I think there's a lot more data coming out. I mean, like again, going back to housing, because it's such a basic part of, we take for granted that we can walk into our homes, but that is not the case for everyone. But, Health Affairs just had a whole, journal dedicated to housing and health. And so there's a lot more data. We know in terms of, we've known for decades the impact that having kind of like a waste treatment facility or a big corporation that's working with chemicals near communities, that affects community health for the communities nearby. Where you're raising cattle and hog, right? The communities nearby get impacted by the pollution in the air, the water, of the feces of the cattle and the hog, right? So we know this, and so we need to make sure that elected officials have this data in front of them. We need to be sure that the public, that corporations are being held accountable for, making decisions that disregard public health, because we know that decisions that corporations make absolutely, even if they're not in the health domain, absolutely affect public health. So I think, again, just making sure it's in a lot of different, that conversation happens in a lot of different rooms. And that's hard because public health professionals can really only be so many places. And so the onus comes on us to really make sure that data is out there, make sure that we, our voice around voicing an opposition or support of something touches a lot of different people. And so that's really hard. I think the other thing, going back to SAPHA, that I didn't mention, and maybe this is embedded, is we really need to focus on our public health infrastructure.
Mhm.
And I think at the beginning of COVID, people may have predicted, oh, well, now people will see, and elected officials would see the importance of local health departments and the importance of investing in public health practitioners. But it's not endured, and we're seeing shrinking local health departments, and we're obviously seeing burnout in healthcare. And so another area, I think, of impact that SAPHA could potentially play, but also an important opportunity for public health leaders, is to be sure that we constantly advocate for a sufficient infrastructure to really help keep the public safe from illness and disease and catastrophe, and also, can respond as needed.
Yeah, I mean, you bring up such a good point. The public health world really has faced a lot of challenges, I think, over the past few years. We touched upon this earlier regarding how politicized public health has become, and the pandemic really, I think, exacerbated that. And then the burnout and the crumbling infrastructure, I think, just makes it a little bit harder to continue to work within public health and make sure that people are doing what they want to do to make change in the world. And I'm sure you felt the brunt of it as well during your work in the nonprofit sector. But how do you continue to stay motivated despite these challenges, right? If you're constantly coming up against all these roadblocks and like this massive move into politicizing public health, how do you continue to wake up every day and stay motivated to do everything?
Yeah. I think the same two things for the first question, or one of the first questions, the people and the promise. And so the people like you all and volunteers that literally still make sacrifices, personal sacrifices, carve out time to volunteer because they want to have impact on someone else's health, or someone else's civil rights, or someone else's ability to find a home in a community they want to live in. We have all been through so much, particularly over the last many years, and people have experienced so much pain and loss. And for me, on like those sad days, I honestly always think about activists and advocates. I feel like activists are the fabric of our country. They always have been. And I'm always amazed at how tenacious activists are and advocates are, how despite how hard the work is and how sometimes the rejection feels, endless, they continue to work and endure, way tougher circumstances than I endure in my work. And that is literally the energy that keeps me going, is that there are people that wake up and do so much. They are protesting, they are advocating, they are going to the Hill, they are writing letters, and that's what keeps me motivated. And the promise is, we can't lose hope, right? Hope that tomorrow will be better than yesterday, and that our work will have impact, and that there are so many people working on this, that there has to be progress. There has to be progress. And so even if it's blind optimism, I will hold on to it. But I think it's really, those are the two things that I continue to hold on to and that keep me motivated.
This has been an enlightening conversation, and I'm sure our listeners have a lot to take away from this. Do you have any closing pearls of wisdom for those aspiring to do work in South Asian public health?
Well, I would say join the SAPHA listserv, for sure. Go to the SAPHA website. I mean, even going to the website was amazing because, that was something we dreamed about in 2002. So there's a lot of great resources there and statements. So I think that's the first part. And I would say connect with people who are passionate about it, about South Asian public health, about public health in general. I feel like now that there's a whole new virtual world, there's a lot of talks to listen to or rooms to engage in with people who share similar passions. So I would just say walk toward it, move toward it, get informed. There's really good information out there, and try to match up your skills and interests with where the gaps are. Find the gaps, what's not being worked on or what could use more hands and or more brain power, and try to make that connection. So that's what I would recommend.
Thank you, Kalpana. Sharing your invaluable insights and experiences with us today was really great. It's been an honor to have you as a guest on the SAPHA Spotlight series. And to our listeners, thank you for joining us on this illuminating journey. Stay tuned for more conversations with past SAPHA board members and leaders in the field as we continue to explore the diverse narratives shaping the landscape of South Asian public health. Don't forget to follow us on YouTube and Spotify for updates, and consider supporting SAPHA's mission by visiting our website, like Kalpana had mentioned, www.sapha.org. Until next time, this is Samira and Thoin signing off. Thank you.